Knock yourself out.
Thank you. Good morning, Chair Sear, members of the committee. My name is Oamshri Amarasingham. I'm the Deputy Legislative Director at the ACLU of Massachusetts. The ACLU has long advocated for drug policy reform, and we strongly support all the bills before you today that would change personal possession of drugs from a criminal to civil offense, authorize safe consumption sites, and generally help connect people with treatment. These bills would move our drug policy away from a punishment model and toward an evidence-based, public health-centered model. Our attempt to arrest our way out of drug use has not worked. Despite half a century of trying the criminal approach, drugs are still readily available throughout the state, substance use disorders remain common, and the death toll is unprecedented. The war on drugs was rooted in and has perpetuated systemic racism. In a 1994 interview, former top Nixon aide John Ehrlichman said the following, and I quote, "The Nixon White House had two enemies, the anti-war left and Black people. We knew we couldn't make it illegal to be either against the war or Black, but by getting the public to associate the hippies with marijuana and Black people with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news," end quote. And this is exactly what has happened. Since 1971, the United States has become the world's largest jailer, despite similar rates of drug use between Black and white people, and even some studies showing higher use among white people. Black people are far more likely to be arrested, charged, and incarcerated for drug crimes. On top of leading to mass incarceration, the criminalization of drugs has created and exacerbated multiple other public health crises. Criminal records bar people from accessing education, housing, employment, and professional licenses. Without stable housing and community support, people continue down a hopeless spiral, which only makes recovery harder. Many people with substance use disorder have experienced significant trauma in their lives. Being incarcerated is itself extremely traumatic, making it even harder to heal. Moreover, the risk of overdose death skyrockets immediately upon being released from prison or jail. Multiple studies show that in the days and weeks following release from incarceration, a person's risk of overdose is 40 to 129 times higher than the general public. Last year saw a troubling rise in overdose deaths, and this increase was most pronounced in communities of color. It is long past time to try a new approach. Safe consumption sites, sometimes called overdose prevention sites, have been operating across Australia, Canada, and Europe for decades and have successfully prevented overdose deaths, reduced the transmission of disease, and connected people to treatment. In recent years, we have seen a national movement to implement similar harm reduction strategies across the U.S. These efforts recognize the wasteful and violent effects of the failed war on drugs, most especially for Black and brown communities and poor folks. Common to these various efforts and local policies is a centralized focus on public health and community safety. The bills before you today reflect this focus, and we urge you to report them out favorably. Thank you.